All right, so Tatiana Ali, y'all remember her, little girl from Fresh Prince of Bel-Air with the long ass hair? Tatiana Ali explains why she's raising capital to address the Black maternal health maternal health crisis. Through her company, Baby Yams, the Grammy Award winner and Abbott Elementary, I did not know she was in that, actor is funding midwives' education. You may have seen her on the hit comedy series Abbott Elementary or as Ashley Banks on the Fresh Prince of Bel-Air, but now Tatiana Ali is using her platform to advocate for Black maternal health. According to the CDC, Black women are almost 3 times more likely to unalive to a pregnancy-related cause. Ali, a Grammy Award winner and longtime activist, joined Scripps. Joined Scripps News to discuss this crisis, how her passion led to her to testify before Congress, and the bill she's hoping to get passed to completely change our outcomes. I came to this work after the birth of my first son, Ali told Scripps News. I experienced obstetric violence at obstetric, that's what it says, violence at a hospital in Los Angeles. After that, I started working with the reproductive justice community, really to learn more during my second pregnancy. I ended up working with a wonderful Black midwife for the pregnancy and birth, and my experience was completely different. I was cared for, I was listened to, and I was safe. Ali's company, Baby Yam, sells quilts with the profits funding scholarships for Black and Indigenous midwives at the National College of Midwifery in New Mexico. Never heard of it, didn't know that they were still doing that. After all of that work, all the advocacy work for the last 5 years, that's why I've turned to trying to raise capital, because that what is inspiring and what powers me is how much we as a community have decided to take matters into our own hands, come together and care for each other, Ali said. Let me go ahead and rectify what I just said. I did not realize, I thought all the people that were doing midwifery had already learned. There was not a new generation. I just figured eventually they would die out. I'm sorry to say that. That's my ignorance right there. I will admit that. So I'm glad to learn something new, and I believe that's the end of that story. But it's good to know that, she may not be as big as she was, but she's still doing something and making a difference. Now moving into our next story. But before we do that, I'd like to play my like commercial again. So please do, if you like the content, please share it. Get my word out, because it's not just about me getting out there. It's also about me actually waking y'all up, the real woke, not the god dang shit that people have bastardized. But anyways, here we go. It's just me and the fam. 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 Yeah. It's just me and the fam. See my little Tay, that's my girl, that's my mascot. No one's go for hours and some hours till we pass out. Stay inside the house, turned up with the racks out. Stay inside the house, turn. All right, so I have reported this time and time again, but here's the closest update. This was reported yesterday on Black Health, and this is at everydayhealth.com. Racism may speed up aging and increase risk of preventable diseases in Black women. I ain't gonna lie. I feel like, I've noticed a lot more gray hair since I moved back up here. And it's like, I'd rather you not hide your distaste for me. Just tell me you don't like me, shit. But anyways, so Black women who experienced greater racial discrimination exhibited brain activity that accelerated aging and put them at higher risk for conditions like heart disease, diabetes, and dementia, according to a study published in JMAA Network Open. These findings highlight how racial discrimination can negatively impact health, says co-author Nagar Fani, PhD, and associate professor of psychiatry and behavioral sciences at Emory University School of Medicine in Atlanta. We were able to show there's increased engagement in a brain network associated with rumination in relation to racism, and it has a link to accelerated aging. This helps us better understand the link between why racial discrimination is so frequently associated with more health problems, says Dr. Fani. Okay, I'm going to stop right there and I want to ruminate on that. Does that mean that my mother, who is from Mississippi, would look like a child had she not been stressed the fuck out by living in Mississippi and growing up in the 60s and 50s and 70s of the US? Wow, she probably would look like she's 40 right now. And I probably would look like a baby because I have experienced some stupid ass shit. Anyways, even subtle racism can have negative health impacts. I'm in the wrong fucking state. I gotta move. Racism is one of the most debated topics in our culture right now. I think it's such a polarizing term, says Fani. Racism can be overt, but it can also be very subtle. I'd rather you be overt. At least I know what I'm dealing with, says Fani. Examples can be a slight, as saying, oh, you speak so articulately. I've had a lot of black women tell me that shit. Or a behavior like a woman clutching her purse as a black man is walking down the street. I actually cross the street when I see a group of people that don't look like me, that are very, very pale. I actually cross the street when I see them. And I clutch my purse. But it's a very real thing, she says. Black Americans experience injustice, hostility, and inequitable treatment based on their skin color, race, and ethnicity. These negative experiences occur in many situations, from medical settings to education to trying to get a job or buy a house. I've had an issue with motherfuckers apparently expecting me to be dumb as shit and not be able to catch on to shit. And they treat me like I'm a fucking bimbo or an airhead because I have no questions. The reason I have no questions is because I fucking understand you. Fuck. They asked me about 20 times before the fucking interview was over. And the only question I have is either, can I have the fucking job or do you have benefits? That's all I fucking want to know. I've already figured out what you're saying. And when I come back, guess what? I'm going to have a notepad because I'm taking notes. Just saying. But anyways, accelerated aging may increase the risk of diabetes, dementia, and heart disease. Well, that's not good for me. To explore how Black women's experience of racism impacts different areas of the brain, researchers recruited 90 Black women who were 38 years old and averaged from the Grady Trauma Project, a community-based initiative investigating trauma-related disorders. Participants underwent assessments for racial discrimination, trauma exposure, and PTSD symptoms. Information about brain activity was collected via MRI, and information on aging was determined using blood samples. There are certain blood-based biomarkers that indicate the difference between our cellular age and our actual age, which gives us an index of an accelerated rate of aging, says Fani. The analysis revealed the relationship between discrimination and accelerated aging by way of higher engagement in this rumination network in the brain, she says. So are you telling me that this country has figured out a way to put us out, just take us out by just stressing the fuck out of us? And I feel like they maybe started that shit when Tulsa went down. Am I wrong? I don't know. Am I reaching? I don't know. But I'm wondering because it sounds like it's going together. It sounds like it's clicking. Just saying. Let me open this other beer, god dang it. Yeah, I agree, beer. I'm a goddamn child of a tomboy. Shit. And for the motherfuckers who don't realize, if you say you're a tomboy, that means you're a girl. If you say you're a tom girl, that means you're a boy. I heard a fucking comedian earlier today say she was a tom girl. Now, the problem is she had argued that so many people keep saying that she's a man or a transsexual. The thing about it is, your dumbass said you was a tom girl. No, you're not a tom girl. You're a tomboy. Tom girl would be a boy, you dumbass. Anyways. Not saying names. I'm just saying you fucked up there. People who had more racist experiences ruminate more, and we think that over time. This is affecting biological aging. We're meant to age at a particular rate, and when we accelerate that rate of aging, we're more likely to experience diseases associated with aging, including diabetes, heart disease, strokes, and dementia. Earlier in life, says Fani, I'm experiencing high cholesterol. Shit, I don't eat. How does that work? These findings could be part of the reason that Black Americans have much higher rates of aging-related diseases and develop them at a much earlier age, she says. Now, I reported to you before that people are menstruating earlier. That could be, and that was one of the factors. I also want to point out that my mom once told me she went to a funeral in Florida, and she said them motherfuckers look old. She said it must have been the sun or they lived a hard ass life. So maybe those people just went through a lot of racism. That's the only thing I could come up with. Because she said them 26-year-olds were looking 41. That ain't right. These findings could be part of the reason that recent data shows that, Black Americans are 30% more likely to unalive of heart disease than white Americans, and Black women are 50% more likely to have high blood pressure compared with white women. And high blood pressure runs in my family, and the women have it. Oh, I'm in trouble. Black Americans twice as likely to develop dementia and Alzheimer compared with their white peers. Real talk, my mother thought I had Alzheimer when I was like 4, so I'm not sure if that I'm in good standing here. This study helps further the understanding of how racism impacts the health of Black Americans, says Michelle, I don't know that name, Michelle, PhD, a professor of epidemiology and prevention and researchers at the Wake Forest University School of Medicine in Winston-Salem, North Carolina. Fucked up thing. I can say epidemiology, no problem. I can't say that woman's last name. That's too many goddamn. I don't know what to do when I see an I and an E in someone's name next to each other, next to a consonant, next to a consonant, next to a. I don't know what to do with that. Alzheimer's disease and related dementias are much more prevalent in Black Americans compared with white Americans. Maybe because we're trying to forget the trauma. And there's been a lot of work going on lately trying to understand what that is, says Dr. Michelle. I ain't saying her last name. Who was not involved in this study. Older Black Americans are twice as likely as older white adults to have Alzheimer or another dementia, and an estimated 21% are living with Alzheimer. I've been looking at my mama. I'm just saying. Further recent researchers suggest that Black people are less likely to be diagnosed or treated until the disease process is more advanced. While some studies have shown that racial discrimination is associated with poor cognitive outcomes or dementia, the mechanism of which it occurs are not yet known, she says. In April, Dr. Michelle co-authored research that found Black Americans who experienced racial discrimination during midlife were more likely to have biomarkers of Alzheimer's disease. I probably got it. These findings are a big step forward because they are actually using MRIs and blood biomarkers to understand the specific efforts of racial discrimination on the brain and the role of biological aging that may be contributing to the increase of risk of Alzheimer's disease and related dementia, says Dr. Michelle. I'm not going to say that last name, I'm telling you. Researchers plan to continue exploring the psychological processes outside a lab setting to understand what happens to people in response to racist threat or experience and what happens when they are ruminating about the experience. I just wanted to point out, don't turn me into a fucking experiment again. I'm not doing that shit. If I put myself up for testing, that's fine, but don't do that shit to me. Seriously. And I want to know, what the fuck would these assholes actually say if they could prove that racism is basically unaliving us in a molecular level, in a cellular level? Would that allow them to shut the hell up when they sit up there and try to say, what are you so mad about? You need to get over it. You know what I'm saying? That's all I want to know. It's like, if they could prove this shit, without a doubt, would y'all listen or would you still talk shit? That's all I want to know. You're going to talk shit or you're going to actually listen? That's really, truly all I fucking want to know. But anyways, here we go. I got another one for you. And then I'm going to go ahead and do the weird ass news. And then I have chopped it up, but hardly anybody's here, which makes me a little upset because I actually have time today. Today I got time, cuz, and ain't nobody really here. And I know everybody has their life and shit and from different areas. So, I'm not too upset. I just wish, still talk ish. Who still talk ish? I don't know. But, I just really want y'all to, still talk ish. I know what you're talking about. I told you, I think I got a little bit of Alzheimer's damn self. I'm stressed all the time. But we're not done. We still got some more medical. Here we go. Play, damn it. All right. So, groundbreaking study to tackle cancer disparities among Black women. This was reported yesterday. Yeah, I got what you were talking about. In May of 2024, the American Cancer Society announced the launch of Voices of Black Women study, a first of its kind initiative that aims to enroll 100,000 participants in the largest behavioral and environmental focused population study of cancer risk and outcomes in Black women in the United States. If the study meets its aims, it could serve a tremendous step forward to understanding disparities in cancer detection, treatment, and survivorship that disproportionately affects Black women. I got to send this to somebody. Though cancer rates are rising in many segments of the United States, Black women are among the most severely impacted. For instance, according to the Breast Cancer Research Foundation, BCRF, why do they always do that? All you have to do is give me the acronym. While there has been an overall 42% decline in breast cancer unalivings over the last 3 decades, there's a persistent mortality gap between Black women and white women. The mortality rate of Black women is a devastating 40% higher than for white women, even though cancer incident rates among Black women and white women are close. This is evidence, according to the BCRF, that cancer breakthroughs haven't benefited all groups equally, and this disparity has remained unchanged for more than a decade. Alarmingly, younger women are increasingly diagnosed with breast cancer, and Black women diagnosed with breast cancer under the age of 50 are twice as likely to unalive than white women. In addition to breast cancer, which is most common and deadly form of cancer in U.S. women, Black women have among the highest mortality rate and lowest survivorship rates for several other types of cancer. Stark racial disparities in mortality also exist for uterine cancer. The American Association for Cancer Research found that Black women have about the same incidence rate as white women, but double the likelihood of unaliving from it. Cervical cancer also disproportionately unalives Black women. In addressing the importance of Voices of Black Women study, Dr. Alpa Patel, one of the co-principal investigators, said the data we've uncovered through previous population studies has been critical in reducing the unacceptably high burden of cancer, but that reduction has sadly not been equal. By centering Black women's voices and experiences, we can dig deeper in uncovering the unique challenges and barriers contributing to cancer disparities and develop tailored interventions to mitigate them. The American Cancer Society study occurs alongside several studies that have linked formaldehyde, a toxic chemical found in hair relaxers that some Black women use, with cancer risk. A paper in the International Journal of Cancer has, for instance, linked the use of chemical straighteners to breast cancer risk. Okay, I'm going to need to sit down and actually read about that, how it just gets the chemical, must go through the blood system, which means that you're actually absorbing these chemicals, not topically, but into your skin and into your blood system. That is terrifying. Similarly, the National Institute of Health also found that hair straightening chemicals increase uterine cancer risk and that Black women may be more affected due to higher use of products with these chemicals. Now, let me see here. I started when I was 12, and at that time, I only needed it twice a year. That was 2 times. But then I had to use a whole bunch of them. 6 times a year, basically, every 2 months until I was, 22? Oh, shit, I got to do my math. I hope I ain't fucked myself up. As a result, the FDA now discourages consumers from using hair smoothing or hair straightening products that contain formaldehyde on the basis. Oh man, I'm so glad I read my shit now. I read everything now. I read my goddamn hair products. I read my food labels, all that shit. Let's see, that contain formaldehyde on the basis that the chemical can be harmful. You put it in dead people. It's very harmful by causing immediate reaction, chronic and long-term problems, allergic reactions, and possibly cancer. NBC News reported that United States lags behind other countries, including Canada, China, and the European Union, which has issued bans or restrictions on formaldehyde products. You need to get Africa, too, because they're sitting up there spraying on them. The FDA is now considering a ban. I mean, all the countries in Africa. Get that continent together, because these motherfuckers is preying on them. You're already trying to get everybody to bleach their skin out there, you dirty bastards. The Voices of Black Women study what we know so far. According to the study's press release, the Voices of Black Women study is an ambitious, get your ass out of here, ambitious 30-year-long undertaking that will include Black women between the age of 25 and 55, diverse backgrounds and income levels. I might be joining this one, who have not been diagnosed with cancer. The 100,000 Black women who participate in the study will be drawn from 20 states and DC, where, according to the U.S. Census, more than 90% of Black women in the U.S. Are you serious? 90% stay in DC? So what the hell are the rest of us, motherfucker? What the hell is my family? I ain't got no family in DC. And I got a big ass family. Recruitment for the study began in October of 2023. Once enrollment has been completed, the American, program has completed. The American Cancer Society will begin accepting proposals for researchers seeking to collaborate. The study is designed to follow women who are currently cancer-free and observe the incident detection. You back? I see you. Observe the incident detection, treatment, and survivorship of study participants over time. Participants will complete a survey to enroll and 2 more each year of the study. The enrollment survey asks questions about medical history, diet, sleep patterns, physical activity, mental health, stress levels, and experience of racism and discrimination. The study will be overseen by the Emory University Institutional. There's an Emory up here, I think. Is that Emory? I don't know. Or review board, IRB. In human subjects research, IRB review research studies to ensure that they comply with applicable ouch, bitch. Man, you got my toe. Damn claw. Applicable regulations, meet commonly accepted ethical standards, follow institutional policies, and adequately project research participants. While there's no specific mention of intent to better understand cancer in Black women on the genetic level, the study includes a sub-study that will acquire blood. Oh, I might have to get out of this. Blood test from participants. I want to help, but shit, how many times y'all gonna get the blood? According to the information available on the American Cancer Society's website for the sub-study, I'm not getting that. Researchers are studying blood samples to better understand participants' genetic information and the genetic changes that may have occurred over time. Researchers are also going to use blood samples to gather information on hormone levels, markers of immunity, environmental exposures, infections, and other metabolic factors like cholesterol levels. According to the hospital, I have it, and it's high. More genetic research is urgently needed among historically under-recognized populations, including Black women. According to the Genome-Wide Association Studies, GWAS Diversity Monitor, approximately 95% of all genomic data is drawn from European white population, with only a fraction, less than 1%, coming from Africa, African American, and Afro-Caribbean populations. And yet there's more of us. How does that work? You do realize that like 5 to 10% are Caucasian, right? Of this world. Everybody else is something brown, some hue of brown. How the hell y'all put all y'all damn studies in these motherfuckers? However, while the additional 100,000 research participants will be useful, it will not be enough to even the scales in the terms of research on the genetic components of the disease for minoritized populations. Still don't understand that minority. Yeah, we're minority in this country. How the hell are we in others? Confronting harm in medical research on Black women. Black women carry a long and sordid history of injustices when it comes to medical research and clinical trials that have understandably stymied their participation in studies that could lead to scientific breakthroughs. For instance, the history of medical experimentation on Black women by the so-called father of American gynecology, this asshole here, James Marion Sims. You need a foot in your crotch. And his surgical theater has become a well-known instance of exploitation and cruelty foisted upon Black women by the medical establishment. Another harrowing example of extractive policies that have been used against Black women for the benefit of science is the story of Henrietta Lacks, whose cells, later dubbed the HeLa cells, are, well, HeLa. The first two letters of her last name and first name were used for research without her knowledge and consent. Her cells, in the more than 70 years since they were taken from her body, became integral to biomedical research around the globe. Not the country, the globe, you dirty bastards. And were involved in scientific breakthroughs that have saved countless lives, though Lacks only survived 8 months after her cancer diagnosis. The fraught relationship between Black women and the medical industrial complex persists today. Human rights violations against Black women still abound in medicine and health policy. In May of 2024, for instance, Stats investigative reporting revealed that doctors were pressuring sickle cell disease patients who are mostly Black to undergo unwanted sterilization. In 2024, bitch, who are they, and whoop their asses, please? The women who were sterilized alleged they were given little to no time to make these life-altering decisions. They were not given all the information needed to make an informed decision. They never received information about less invasive alternatives. So you took these people's gift so that what? They wouldn't make more people with it that wouldn't mix with your blood? Is that what you're trying to say? I mean, how about y'all work on getting rid of it instead of taking someone's gift? These incidents not only continue to shed light on how doctors too often abuse Black women, but they also tie into America's hidden history of eugenics, whereby Black women and other women labeled undesirable had their reproductive autonomy stripped from them when they were forced or coerced into sterilization by hysterectomy or tubal ligation. It took until April 2024 for the Department of Health and Human Services to release a letter to teaching hospitals and medical schools affirming that written and informed consent is needed before sensitive and intimate examinations such as breast, pelvic, and rectal examinations are performed on patients. Previously, such exams were routinely conducted on anesthetized patients at teaching hospitals. Because teaching hospitals often serve vulnerable populations, the practice, according to Time, disproportionately impacts poor and public patients, many of whom are uninsured or minorities. I know I had to, and a lot of us had to go to them damn hair schools too. That's the gamble, motherfucker. But when you broke, you broke. Due to the concerns, I went to a dentist school in Japan. That was very hard for me. I'll tell you about it one day. To the concerns Black women have when it comes to participating in research studies, enrollment for Voices of Black Women study may prove challenging. However, there are signs of hope. Dr. Shauna Nitri, a family medicine physician and medical director of University of Maryland Greenbaum Comprehensive Cancer Center, Baltimore Cancer Program. Why is that so long? Who is also one of the study's volunteers, told her local news station that she's excited about the study because we'll get more information from Black women, which will help us direct education and outreach. While this initiative by American Cancer Society represents an important step forward for health and equity and social justice, we need bigger and bolder investments to positively impact Black women's health. Hopefully, the American Cancer Society's efforts will also inspire large foundations, federal agencies, and industry to support studies that offer Black women the care and consideration regarding their health and well-being that they have too often been denied. And that is it for the health side.